Hey gang, Dr. Mankal here from Barhaven Family Chiropractic here in Ottawa. People ask me all the time about this work that we do called NeuroStructural Chiropractic, and I want to explain to you a sort of amazing case that we saw recently and some of the results the patient had because a lot of people suffer needlessly, and they've tried different things including traditional chiropractic care. Structural chiropractic care is like looking at the foundation of a house. If the foundation drops, that becomes a primary problem. But it also causes other problems within the dwelling of that house, right? So the windows, they don't close very well. They're really stiff. The doors start jamming, the wall cracks, and then the floor starts shifting. So our focus here in chiropractic is we focus on the structural element of the spine because it directly affects what happens to the nervous system, to the muscles and ligaments and the discs. So I want to talk to you about a case that we had recently that for this lady, she's 42 years of age, and she had been suffering for over 2 years with chronic pain. So we did her assessment. We took some x-rays. This is the side view of her neck. The green marker is where she should be, and the dotted marker is where her current structural alignment is. And we start to see that the discs between 5 and 6 and 7, we're getting some degeneration there. So because the structure shifts, and that measurement from here to here was about over 4 centimeters worth. The muscles at the back have to work so much harder to try to keep her head over her shoulders. She was also starting to get numbness and tingling pain down her arm into her hand. So then we started to do this neurostructural work to improve the structural alignment of the spine. And this is her post picture 16 weeks later. So her head position now, this number, went down to just over 2 centimeters. So she had like a 50% change in structural correction in literally about 16 weeks. And we start to see the opening of the disc spaces at 5 and 6 and 6 and 7. So in a very short time, using neurostructural adjustments, mirror image adjustments, and neurostructural exercises, we can literally get a phenomenal change, kind of like putting braces on somebody's teeth. So this is another way that takes people to another level of their health and well-being. If you've never really tried that, never had a neurostructural assessment, maybe you don't have to suffer. And I talk about this case because many people do suffer and don't know there's actually answers out there or something that's maybe different that you haven't tried before. So if that's something that interests you, consultations are always complimentary here. Give the office a call here, and our team will set you up for at least a complimentary consultation and maybe ask me your questions and concerns before we have you come in and do your analysis there. So I hope you find that helpful and to help you enrich and really living a life without being in pain all the time. So we'll talk to you soon. Bye for now.